Guys, welcome back to Med Nuggets podcast. So today we will be talking about some mind-blowing health benefits of vaping, right, Malisha?
Yeah.
Yeah, so some of our Instagram followers they actually suggested this topic to us, so we thought of making a short episode about it. So let's start with the first one, right? It helps in the development of asthma. So we all know that smoking it is bad for your health, right? And it damages your lungs. A lot of people they have turned to e-cigarettes to help them quit smoking or as an alternative to smoking. And vaping it is even marketed as an effective smoking cessation aid. But science and research they do not support these claims.
Yeah.
According to research using e-cigarettes, which is also known as vaping, it is also harmful to your lung health because it can cause an inflammation in the airways and cause breathing difficulties, which can intensify asthma symptoms and even trigger asthma attacks. So, one US research they found that high school students who vaped they had a higher risk of asthma attacks and were more likely to miss school due to severe asthma symptoms. And teens who use e-cigarettes at a higher risk of moving to these traditional tobacco cigarettes according to the American Academy of Pediatrics. So this long-term use of e-cigarettes this increases the risk of respiratory diseases like asthma and COPD, which is chronic obstructive pulmonary disease.
Yeah.
Right? It's a condition where you'll have difficulty in breathing. So this is most commonly seen in smokers, right? We all know that most of the smokers, they develop COPD at some time in their life.
Yeah.
So COPD is a chronic condition, and e-cigarettes have not been used for that long to see if there is a direct correlation between vaping and the development of COPD. But with research so far, it shows that it makes symptoms worse. So even though you stop smoking and then you turn to vaping, you still have that same risk as a smoker to develop COPD
Yeah.
because vaping is similar to smoking as well. Even though you do not inhale the smoke that comes with tobacco smoke, with when you even though you don't inhale that smoke with e-cigarettes and other vaping devices, you still inhale aerosol,
Yeah.
the mist. So this can cause the lung inflammation that tobacco does, right? And also these e-cigarettes they have certain harmful chemicals like nicotine and also buttery flavor called diacetyl. These diacetyl can cause scars in your lungs and even narrow your airways. And it can lead to a serious condition called popcorn lung, which has the same symptoms as
COPD.
COPD. And also, you get a good dose of these harmful chemicals from secondhand vaping, just like you do from secondhand smoking.
Yeah.
So, vaping is not so different to smoking, it's almost the same.
Yeah. And another dangerous condition you can develop from vaping is EVALI, also known as e-cigarette or vaping use associated lung injury. So, EVALI is actually a type of, as the name suggests, it's a type of acute lung injury that is caused by the harmful chemical substances in vaping products like THC, which is also known as tetrahydrocannabinol. That's a chemical that is present in weed, in marijuana, right?
Mm.
And vitamin E acetate, these harmful chemical substances they can damage your lung tissue. So EVALI it actually presents like a pneumonia, right? So with pneumonia like symptoms like fever, chills, cough, breathing difficulties and stuff like that, right? So when people first presented with these symptoms to the hospital, the doctors they thought it was a pneumonia and they gave these patients antibiotics and it didn't work, right?
Mm.
So the doctors they went ahead and they tested these patients for infective causes like for bacteria, viruses and fungi, all of which tested negative in these patients, confirming that this wasn't a pure simple pneumonia that we are dealing with, right?
Mm.
So then the doctors they went ahead and they took fluid from the respiratory tubes of these patients and they found something interesting. They found that this fluid it contains THC and something called vitamin E acetate. Now, I know you must be thinking, what's so wrong with a bit of vitamin E in your lungs,
Yeah.
right? So, the thing with vitamin E in your lungs is it's not like applying a cream or taking a pill, a tablet, right?
Mm.
Because the thing with vitamin E in your lungs is that it's the thing is when you take vitamin E as a cream or a tablet, it's absorbed to your body in a different way and processed in a different way versus inhaling it and vitamin E having to go through your respiratory tubes to your lungs, because that is something totally different and harmful because it can irritate your lungs to a point that it even can cause you to die, right? actually 2.4% of patients with EVALI, they die from the disease itself, from EVALI itself, right? And not only that, these 80% of these people, they also experience gastrointestinal symptoms like nausea, vomiting, and stomach pain and stuff like that, you
Mm.
know.
That's interesting. I think a lot of people they do not know about this condition as well.
Yeah,
It's not talked about a lot, right?
yeah,
And another condition is lipoid pneumonia. I think that is also something that a lot of people do not know.
yeah,
So previously, lipoid pneumonia was associated with the use of oil-based laxatives and accidental aspiration. But now that's changing because a lot of people now are vaping and they are voluntarily introducing these lipid particles into their lungs.
yeah,
So this lipoid pneumonia, this develops when fatty acids, which are the building blocks of fat, right? These enter your lungs. It's different to the classic pneumonia, which is usually caused by an infection.
yeah,
Right? So these fatty substances, these oily substances, they cause an inflammatory response in your lungs, and it can result in a chronic cough. You can have difficulty breathing, and you may even cough up blood. So the problem with this condition, lipoid pneumonia, is that there isn't a good treatment for lipoid pneumonia. So the maximum a doctor can do is to give supportive care until your lungs heal by itself.
yeah,
So, the most important thing in the prevention and in the treatment of this condition, lipoid pneumonia, is to eliminate the cause, which is stop vaping, right? And lipoid pneumonia can even be fatal without the proper support and without proper treatment. And even after you recover, you can have this permanently decreased in lung capacity.
yeah. And another condition that vaping can cause is lung cancer.
Hmm.
We've heard it time and again that cigarettes cause lung cancer. I mean, the packaging itself warns you that smoking kills,
Yeah.
right? So, even though vaping is far less harmful than regular cigarettes, science says that they are not a safe alternative to smoking because e-cigs has aerosol, which contains nicotine, a substance that is known to slow the development of brains in fetuses, in children, and teens. Now, I know that there are nicotine free e cigarettes, but studies have shown that even e cigarettes claiming to be nicotine free, even these cigarettes, they contain small amounts of nicotine, right? So, this nicotine, together with some of the volatile organic compounds commonly found in vapor like benzene, heavy metals, formaldehyde, and all this stuff, they can cause lung cancer.
Hmm.
And lung cancer is not that simple because when we talk to patients in our hospital with lung cancer, every single patient, at least the ones I've come across, they say that if they knew that they would have to be connected to a ventilator, breathing machine to help them breathe for the rest of their life, they would have never laid their hands on a cigarette ever.
Hmm.
So, I mean, it's easy to just die at once rather than suffering in pain for years and years, right? And
Hmm.
waiting or wishing for death. So it's like imagine someone dips your head in water and you find it hard to breathe for like 30 seconds or something. It's uncomfortable, isn't
Hmm.
it? So now imagine that feeling for the rest of your life. And trust me, some patients have told me that the breathing difficulty you experience in cancer is not even close to that you feel when someone dips your head in water, right? It's way more
Worse.
worse than that.
Hmm.
And then moving on to the next condition that vaping can cause, that is stroke.
Stroke.
Stroke is not a joke, right? So, not being able to move parts of your body like your hands and legs. What's the word for that again?
Paralysis.
Yes,
Paralysis.
exactly. I mean, having to totally depend on another person to get your work done, becoming a burden to your family, your
Children.
children,
Yeah.
your wife, or your husband for the rest of your life doesn't sound that much fun,
Mm.
does it? And experts warn that vaping can cause strokes at a younger age than smoking cigarettes. And according to scientists, adults who use e-cigarettes run the risk of suffering a stroke 11 years earlier than tobacco smokers. And also researchers with the American Heart Association, they say that those who vape, they have a 15% higher risk of having a stroke at a younger age in comparison to those who smoke regular tobacco products,
Mm.
you know.
And e-cigarettes, vaping, it is as addictive as heroin, as cocaine, as tobacco smoking, everything, because it
Yeah.
contains nicotine, like we said,
Yeah.
right? And what's worse is that these e-cigarette users, they can get even more nicotine than they would from a usual normal tobacco product
Mm.
because they can buy extra strength cartridges which have a higher concentration of nicotine or even increase the e-cigarette voltage to get a greater hit of the substance. So this can actually be much worse than tobacco smoking, even
Yeah.
though we do not promote that as well.
Yeah. And another thing that vaping can cause is explosions, something you might not think of,
Yeah.
right? So yeah, so one known risk of these vaping devices is the possibility of fires and explosions. And the cause of vape pen explosions is not the vape pen itself, but it's the lithium ion battery that the vape pen uses, which can cause these fires and explosions, right? Actually, the majority of these fires and explosions that have taken place the majority of these fires and explosions have taken place while the device is in the user's pocket or while the person was using
Using.
this. And so because of that, it can lead to injuries of the legs, thighs, mouth,
Scalp.
face, yeah, all that stuff. So ranging from cuts and lacerations to severe burns, right?
Mm.
And eye and ear
Injuries,
injuries.
yeah, and even death.
Yeah, and even death. So, and also permanent scarring,
Figment.
disfigurement, loss of limbs, and stuff like that, you
Mm.
know. So, according to the US Fire Administration, from 2009 to 2016, 195 incidents of exploding e cigarettes has been reported, which has caused 133 injuries. Yeah. And also, I actually read this study on the Curious Journal that these explosions they actually happen through a process called thermal runaway. So what is thermal runaway? Thermal runaway is something that happens when the battery overheats and
Mm.
the temperature inside the battery it increases to the point that it can cause an explosion, right? And things like overcharge, external heat, short circuit, things like that, these are a few things that can cause thermal runaway, right? So vape pen fires and explosions can take place with any brand of cigarettes or any type of e-cigarette as long as the device uses a lithium ion battery,
Battery.
because it's this lithium ion battery that leads to
Explosion.
explosions.
Yeah. I think a lot of people, especially our younger generations, like the young people, they are enticed by these e-cigarettes because they believe that vaping is less harmful than
Yeah.
smoking, right? It reduces the stigma of smoking. It's more appealing than smoking. It has a better smell, right? Because of the
Yeah.
flavor and all that.
Yeah.
But the effect it has on the body is similar to what tobacco smoking does. So, if you are someone who vapes regularly, we hope you got some insight into the harmful effects of vaping and maybe at least slightly convince you to stop using it.
Yeah.
So, with that, we end our podcast and thank you for listening and see you soon.
Yeah.
Have
Have
a
a
nice
nice
day.
day, guys.